Game.
Visible na po.
Yeah.
So, good morning po, Doc. Good morning, classmate. We are the reporters of Mr. Bisaya. And the topic is the death related to sports. So, today's agenda, we have number one is what is sports. Number two, what is sports injuries. Number three, recognizing and classifying injuries. Number four is types of injuries. Number five is sports and estimated injured athlete. Number six is causes of death in athletes. And number seven, challenges in sport. Wait, di ko makita. Ay, wala pala akong sound. So, every day, a lot of people all over the world participate in games and sport activities or competitions. Participation in sports improve physical fitness and overall health and wellness. Games in sports can also result injuries, some minor, some serious, and still other lifelong medical problems. Sport injuries result from acute trauma or repetitive stress associated with athletic activities. Sport injuries can affect bone or soft tissues, ligaments, muscles, tendons. There are numerous sports injuries happen in the field of sports. All coaches, trainers, and players need to know the cause, symptoms, prevention, and treatment for all these common injuries to avoid most of this type of injuries, and also to update the poor training method. This paper will review the general common sports injuries. Next is what is sports? Sports mean all of Sports mean all form of physical activity which through casual or organized participation aim at expressing or improving physical fitness and mental well-being, forming social relationship or obtaining results in competition at all levels. Next is what is sports injuries? Sports injuries are injured that occur in athletic activities or exercising. They can result from accident, poor training technique and practice, inadequate, inadequate equipment, and overuse of a particular body part. In the United States, there are 30 million teenagers and children alone that participated in some form of organized sport. About 3 million avid competitors, 14 years old of age and under experience sport injuries annually, which causes which causes some loss of time of participation in the sport. Injury rates are highest from athletes who participate in contact sport, but no serious injuries are associated with individual activities. Between one half and two-thirds of childhood sports injuries occur during practice or in the course of an organized athletic activity. Recognizing and classifying injuries. Sport injuries may be classified in relation to the type of tissues injured: soft tissues, muscle and skin, or hard tissue, bone. More often, sport injuries are classified in relation to their cause. The main types of the main types are primary, secondary, direct, indirect, and chronic injury. Primary injury occurs directly as a result of sporting activity. The secondary is occurs as a result of an earlier injury which may be have treated inadequately in at all. Also may occur when the athlete return training and competition before a previous injury has healed full. The direct injury occurs as a result of an outside cause such as an external blow or extreme force applied to the body, frequently the most immediate and severe type of injury. More than one type of tissue can be damaged in one incident. For example, a dislocation of shoulder can involve muscle, tendon, ligaments, and nerves. A severe sudden impact with the ground in a ball with another athlete or with sports equipment can produce internal bleeding with or without fractures. Be aware that protective gear has limitation. Shoulder pads will protect a rugby player, from bruising but not from fractures or dislocation. NIPAD will not reduce the incidence of internal injury to the knee tissues. Athletes must be made aware of such limits and not be lulled into a false sense of security. Next is indirect injury. Usually occurs as a result of the individual's overestimation of their body capabilities. Many of these types of injuries may be prevented by attending to fitness, overall pre-season, in-season, or off-season. Preparation, suitable clothing and equipment, warm up, stretching, warm down, and techniques, use of correct techniques. Next is chronic injury. Occurs a result of overuse, may be result in appropriate use of the body which place excessive stress on a particular tissues, bones, ligaments, and other soft tissues. Poor training program cause the majority of chronic injuries. May be caused by poor technique which increases the load placed on some structures. Poor backhand technique in tennis may overload structures that stabilize the elbow joint. Stresses are usually repetitive in nature and cause micro damage micro damage to tissues, which under normal circumstances are able to repair the damage naturally. If the stress continues and becomes excessive, the damage accumulates until it exceeds the body ability to repair itself naturally. Next is the type of injuries. First is sprain. Sprain are injuries to the ligament. The more the ligaments are torn, the more severe the injury. Ligaments can rupture completely and or dislocate the bones they attach to. Ligaments may be pulled away from their point of attachment, especially in young children. Fractures may also occur. Treat severe sprain as fracture. Not all symptoms will always be immediately apparent. A mild sprain only stretches the ligament with the brief period of pain only. The athlete is able to return to activity with a little discomfort. Sprains are often not treated and the joint is frequently re-injured. They became chronic, indirect, or secondary injuries. This is the example of sprain. Next is next is strain. Strain are injury to muscle or tendons. The more often, the more the muscle fibers are torn, the more severe the injury. Usually caused by overexertion, lifting something too heavy, working a muscle too hard, or sudden uncoordinated movement. Not all symptoms will always be immediately apparent. Without immediate treatment and sufficient rehabilitation period, strain may become chronic, particularly in the neck, lower back, and the back of the thigh. So this is the example of strain. Next is dislocation. Dislocation are injury where one or more bones are completely displaced. They can cause fracture and damage to ligaments, tendons, blood vessel, and nerves. They are generally more obvious than fracture because of defor- deformities. A long ridge or depression. Joints at the shoulder, thumb, fingers, and jaw dislocate more easily than others because there is a wide range of movement possible at these joints, and the bones, ligaments, and muscles do not provide a lot of protection of the joints. It may be impossible to distinguish a dislocation from a fracture to treat it as a fracture. This is a example of dislocation. Next is concussion. Not all signs and symptoms need to be present for concussion to have occurred. Symptoms may as may may mass other injuries, skull fracture and compression. With any of these facial or scalp injury, bleeding, contusion or bruising, check for concussion. A skull fracture may be present without much evidence or external damage. Initial symptoms may be brief and recovery rapid. It is essential to seek professional assessment as signs can reappear anywhere between 6 to 48 hours later. The most important thing to remember about concussion is that it means that brain has been damaged. The severity of concussion is measured by two things. The length of time there was First is the length of time there was been the loss of consciousness. The second is the length of time where was been memory loss. This type of concussion. Next is nosebleed. A nosebleed is a much underestimated head injury, often due to rupture of the blood vessel inside the nostrils. Can be caused by can be caused by a blow to the nose, sneezing, or blowing the nose, and may be indication of head injury. To check for concussion. Look for watery looking blood-stained fluid if present. Suspect a skull fracture. Can cause considerable blood loss. May cause vomiting if blood is swallowed, and can affect breathing if blood is inhaled. Next is black eye. Usually caused by a blow cause, usually caused by a blow over the orbit, the eye socket. May be associated with an unnoticed concussion, rupture blood vessels would then render the white of the eye, bruising of the facial tissues, eyelids often begin as a deep reddening and later becomes dark blue. As the surface of the eyeball appears flattened, the injury is serious, immediate removal to a hospital, preferably one with an eye unit is important. If the athlete has cloud vision or no vision, urgent medical assessment is needed. Next is hard tissue injuries or fracture. There are a number of different types of fracture. They may be classified as a simple or cross fracture and compound or open fracture. In, in a compound or open fracture, the bone breaks the surface of the skin. When the first examined, injuries may appear to be severe sprain rather than fracture. In a doubt, treat them as a fracture. Any fracture accompanied in extensive soft tissue injury involving bleeding and inflammation of the tissues. In severe case, bone fragments may be forced into organs, causing additional damage. Open fracture may become infected. Internal bleeding will attend close and cold fracture. Internal and external bleeding will attend compound or open fracture. Shock will be a factor and must be treated even if only as a precaution. This is a type of bone fracture. So next is knee joint injuries. Knee injuries involve trauma to one or more tissue that make up the knee joint. Ligaments, tendons, cartilage, bones, and muscle. This, this type of injuries may happen due to a fall, forceful twisting of the knee, or high impact from motor vehicle accident or another force. Next is groin strain. A groin strain is an injury or tears to any of the adductor muscles of the thigh. These are the muscles of the inner side of the thigh. Next is hamstring strain. A hamstring strain generally occurs as a result of muscles overload, just as wait lang, wait lang. So, hamstring generally occurs as a result of muscles overload, just as when you are running and your leg is fully stretched out just before your foot strike the ground. When your foot strikes the ground and all your weight is on, the muscles can get stretched too far and they may start to fail. So, the next slide will be reported by the Jasper, ikaw na.
Bigyan ko lang ng kaunting explanation dun sa hamstring strain. Mapapansin mo na may injury ka na ganyan sa iyong hita kapag matindi yung sakit doon sa likod. Yan ay sa bandang likodan kasi napunit yung muscle mo na nakadikit doon sa bone. So, yun. Next slide. Low back pain. Lower back pain can be caused by a variety of problems with any parts of the complex. Interconnected network of spinal muscle, nerve, bone, discs, or tendons in the lumbar spine. Ang the most common cause of lower back pain is ano po, straining a muscle or spraining a ligaments. Yan po ay nangyayari kapag yung matindi na yun sa sports, lalo na yun sa mga gymnastic. Yan po. Kasi nababanat yung likod nila na focus po ng pananakit ng likod. Next slide. Yan. Dental damage. Blow to the jaw can crack, break, or dislodge teeth due to the basketball sports. Yan. Alam naman natin na sa basketball, matindi yung physikalan dyan na hindi natin alam na nasiko na tayo sa ngipin, sa panga, kaya nagkakose ng pagkapingas ng ngipin, pagkatanggal, yan. Karamihan sa dyan sa mga physical sports ay nangyayari yan. Next slide. Cut and abrasions. Abrasion in sports are usually caused due to the friction arising when a sports person come into contact with a surface at high speed. The rawness of the surface may contribute to the extent of the damage. Such scrape can occur in many contact sports and track events. Next slide. Treatment for sports injuries. Treatment depends on the type of the severity of the injury. Always see your doctor if the pain persists after a couple of days. What you may think is a straightforward sprain may actually be a fractured bone. Uh, Physiotherapy can help to rehabilitate the injured site, and depending on the injury, may include exercise to promote strength and flexibility. Returning to sports after injury depends on your doctor's or physiotherapist's assessment. Trying to play before the injury is properly healed will only cause further damage and delay recovery. The biggest single risk factor for soft tissue injury is a previous injury. While the injuries heal, you can maintain your fitness and choosing form of exercise that don't involve the parts of your body, if possible. Next slide. Sports and estimated injured athlete. According to CPSC data, there were an estimated 454,400 sports-related head injuries treated at US hospital emergency room in 2018. This number represents a decrease of nearly 32,875 sports-related injuries from the previous years. Of, of other sports noted below, most of them posted a decrease in the number of injuries treated from 2017. Ah, sa US pong rate ito ng mga na-aksidente sa sports, and the actual incident of head injuries may potentially be much higher for two primary reasons. In the 2018 report, the CPSC excluded estimates for product categories that yield 1,200 injuries or less, those that had very small sample count and those that were limited to a small geographic area of the country. Additionally, the system does not track many severe head injuries treated as physician officers, immediate care centers, or are self-treated. Sports and recreational activities, in addition to the equipment and apparel used in these activities, are included in these statistics. For example, swimming-related injuries include the activity as well as diving boards, equipment, flotation device, pool, and water slides. Next, the following sports and recreational activities represent the categories contributing to the highest number of estimated head injury treated in US hospital emergency room in 2018. In cycling, 64,411. In football, 51,892. In baseball and softball, 24,516. And sa basketball, 38,908. Powered recreational vehicle, 30,222. And soccer, 26,955. And for skateboards, 10,573. Exercise and equipment, 37,045. Houseback riding, 6,141. Sa golf, 6,357. Sa hockey, 7,668. And sa trampolines, 8,956. Rugby and lacrosse, 10,901. Sa skating, 7,143. And sa playground equipment, 38,915. Yan, ganyan kadami yung tao na injured sa larangan ng sports. Kasi may mga iba-ibang paraan na may kulang at mayroong labis na may mga labis na pagkamithin ng pagkapanalo kaya nangyayari yung mga ganyang aksidente. And next slide. The top 10 sports-related head injury categories among children age 14 and younger. First, playground equipment, 35,058. Football, 31,277. Basketball, 20,242. Cycling, 19,921. Baseball and softball, 12,065. Soccer, 12,709. Swimming, 9,265. Trampoline, 7,921. Powered recreational vehicle, 6,036. And skateboard, 3,100. Ito yung sa mga head injuries na age 14 younger. Kasi minsan yung equipment, dito sa playground equipment, mga damit nila na hindi naman fitted sa kanila. Kaya yun, magkakaroon ng taas na rate of injuries. Next. During sports season, especially football or marathon, sports-related cardiac sudden death has been reported occasionally. Although it might seem to be uncommon for athletes who are physically fit, this fatal event can happen to anyone at any time. The answer remained unclear why this life-threatening condition could suddenly kill athletes who had never presented any sign and symptom of cardiac disease. Placing into perspective the program on screening and other measures to prevent sudden cardiac death and improve outcomes, it is greatly considered an important key. Next, cause of death in athletes. It has been widely acknowledged that exercise is an effective tool for improving health. Exercise has been strongly associated with beneficial change in cardiovascular risk factors, including blood pressure, lipids, insulin sensitivity, and body weight. Numerous studies that have consistently shown an association between moderate aerobic exercise and decreased risk of coronary heart disease, although the heart benefits to exercise are well documented. Patients diagnosed with cardiac conditions who engage in exercise and athletic competitions may, on rare occasions, experience sudden cardiac death. Next, sudden cardiac death in the most common medical cause of death in athlete with an incident of approximately 1 in 50,000 to 1 in 300,000 athletes per year, according to the most recent estimate in the recent 10 to 20 years. The risk and causes of sudden cardiac death vary based primarily on the athlete population. Although rare, sudden cardiac death in the athlete is a traumatic event that has a large impact on society. Sudden cardiac death in the young have devastating consequences for families, health providers, and the community. Sudden cardiac death is a tragedy in any age and under any circumstances, but is perhaps most tragic when it claims the life of the athlete. The individual who of epito, epitomize health and the healthy lifestyle. Ito. The most common cause of sudden cardiac death in young athlete under 35 years of age retrieved from medical database of 1,100 athletes in the United States include uh, nangunguna yung 36% of deaths are caused by hypertrophic cardiomyopathy, a disease in which the heart muscle myocardium becomes abnormally thick, hypertrophied. The thick, the thickened heart muscle makes it harder for the heart to pump blood effectively. Sunod na ano ay 17% of deaths are caused by anomalous coronary artery, defined as a coronary artery that has an abnormality or malformation, which is ano yun? Congenital, present at birth, and most often related to the origin of location of the coronary artery. And 4% of death are caused by the abnormality of electrical activity generated by cardiac muscle. Besides this cause, there are other trigger factors that largely contribute to sudden cardiac death, presenting with sudden dizziness, palpitation, and severe chest pain. In athletes older than 35, most sudden cardiac death events are caused by acquired uh, atherosclerotic coronary artery disease. Many of these diagnosed may not be clinically apparent and may first present with sudden death. Due to the advancement in cardiac technology and diagnosis, the screening program significantly helped to early detect the cardiac abnormalities, which are major factors for developing sudden cardiac death, even without the presence of warning signs and symptoms. Cardiac muscle and sudden cardiac death. Cardiac muscle tissue or myocardium is a specialized type of muscle tissue that form the heart. Cardiac muscle contracts the release involuntarily. It is the responsible for keeping the heart pumping sufficient blood to supply the whole body, including the brain. Cardiome- Cardiomyopathy is a heart muscle disease that makes it difficult for the heart to pump. There are different types of cardiomyopathies. The most common heart muscle disease that cause sudden cardiac death in athletes is called hypertrophic cardiomyopathy, a disease in which the heart muscle becomes abnormally thick. The thick heart muscle makes it harder for the heart to pump blood sufficiently to the rest of the body. Nevertheless, heart muscle typically becomes thicker in athletes without clinical abnormalities. To screen and diagnose accurately, advanced advanced diagnostic tool, ec- echocardiogram, and highly expert sports cardiologists are crucially important. An echo an echocardiogram is diagnostic cardiac ultrasound. During the test, ultrasound, high-frequency sound wave from a handheld when placed on the chest provide pictures of the heart pulse, chamber and structure and help evaluating the pumping action of the heart. Not only screening by echocardiogram, but other medical history, underlying disease, and family history of cardiovascular disease must be also used to evaluate risk and sudden cardiac death. In this picture, yan po yung nagkaroon siya ng sudden cardiac arrest na cause ng kanyang uh, ang pagkabagsak ng kanya. Sudden cardiac death in athlete in a catastrophic event that can be effectively treated through prompt and coordinated emergency response, ep- early defibrillation by using an automated external defibrillator, and early CPR. Pre-participation evaluation remains essential to identify any abnormalities that might potentially potentially lead to sudden cardiac death. Challenge in sports. Uh, this uh, this topic po is about gambling, challenge gambling in sports. It is only very recently that a worldwide blanket ban on betting and gambling for certain participants in English football was introduced in a bid to tackle corruption in the game. Participants covered by the ban will be prohibited from betting, either directly or indirectly, on any football match or competition that take place anywhere in the world. Research on athlete and compulsive gambling is extremely scarce. However, athletes may be more vulnerable than the general population to gambling addiction. When you look at the soft sign of compulsive gambling, these include high level of energy and unreasonable expectation of winning, extremely competitive personalities, disturbed optimism, and often intelligence with high IQ. All of these are often traits of the competing athletes. Yan. High level of energy, unreasonable expectation of winning, and extremely competitive personalities. Yan yung nagiging focus ng isang athlete kapag may involved yung gambling. Kasi kailangan talaga nilang manalo. Kasi kahit anong mangyari sa kalaban, basta manalo sila gagawin nila. Yung unreasonable expectation of winning, kahit masigo nila, masipa, lalo na sa larangan ng basketball, kapag kailangan talaga manalo, kailangan mo mandaya. Kailangan persahin ng kalaban, ng mag-focus naman sa kalaban ng injury o sakit sa katawan. Next. The focus on addiction among athletes has gained considerable attention among sports medicine clinicians, with a develop of diagnostic indicators, risk and protective factors, and a stage model of addiction among athletes. Gambling may often be seen as a comorbid factors with other addiction and issues such as depression. However, its prevalence in athletes alone should not be overlooked. Dito, mismo yung sports medicine clinician yung nagpapatunay na kapag involved yung gambling, marami talaga yung aksidente. And Rocky 1998 reported that the athletes in his study, in comparison to all students, had higher rates of both problems and pathological gambling. Of the athletes surveyed, 12.4% scored in the problem range, compared to 7.3% of all students, and 6.2% scored in the pathological range. Rocky Bison and Gilbert 2002 supported this finding, noting that university athletes have a higher rate of problem gambling than non-athlete do. In addition, the result of this study suggests that athletes prefer to, go, to gamble and to gamble on games that include high level of skill. It can be speculated that as athletes participate in game of skill themselves, they prefer gambling activities that are particularly challenging and competitive. By placing bets on this activity, athletes increase the risk, would add the level of competition. Yan. Meron naman tayong mga atleta na laro lang yung habol. Laro lang yung habol, papawis lang, exercise para ma-stress yung katawan. Pero iba yung may halong gambling. Kapag hinalon siya ng gambling, kahit ano na mangyari, kasakitan, basta manalo, ginagawa yung paraan. Kaya nakalagay dito ay yung athlete increase the risk. Ito yung mga na-aksidente, tamaan sa ulo, na-injure yung kamay, na-strain, na-dislocate. Kasi force yung laban intense. Kasi kailangan manalo. Compare sa mga gusto lang magpapawis magluto. Next slide. If a competitive athletes begin to gamble, it can take as little as one win to get hooked and one loss to one. Okay. Sorry po at may naglalaba po dito yung gamit i-pag-book kaya maingay. Okay, diretso ko na lang. If a competitive athlete begin to gamble, it can take as little as one win to get hooked and one loss to want that win back, and this is how the cycle to addiction can begin. Normally, when a loss take place in gambling, the normal reaction for a person who is not at risk or it's simply participating as an innocent means of entertainment would be to not continue. However, the competitive athlete may begin to employ specific strategies and make adjustments in how they gamble. When they gamble and what they gamble on, with the mindset that they can create situational which will result in they win. In-emphasize dito na kung kung mananalo ka na kung matatalo ka na meron kang na-involve yung gambling, yung mindset mo is parang gusto ka, na-addict ka maglaro ng sports na pinagkakitaan mo na. Kaya ang mangyayari to, gagawa ka ng mga kahit anong strategy na kahit anong mangyayari, kahit na cost ng harm sa kalaban, gagawin mo. Next slide. Corruption. Sa corruption challenge naman sa mga athletes. Corruption in sports affect the financial health of federation, club, and athletes erode public trust, and saps the societal impact of sports activity. The educative and ethical values of sports and their capacity to foster positive social change and depend on the exemplarity of sporting role models and the credibility of sporting institutions. Therefore, corruption in sports is a matter of public interest because countries invest in sports and rely on it to promote health, educated, and social benefits. Yan. Kapag naging corrupt yung mga nagpapatupad yung mga nag-aasikaso ng mga sa sports, ah, maaaring hindi maging prepare yung ating mga athlete kasi yun yung gagamitin nila para makabili ng kanilang mga gamit na fit sa kanilang katawan para mas okay yung kanilang pagsalang sa laro. Yun. Kaysa naman pag wala silang budget, hindi sila makakapamili ng saktong equipment o para makagalaw sila ng maayos. At yan. Next slide. Potential serious injuries to children from faulty sport equipment. Ito. If your children is playing a sports, you need to make sure his or her equipment is maintained and in good working condition. This is especially true if the equipment is for safety, such as a helmet. Should a helmet not be good working condition, it leaves your children exposed to suffering a severe head injury, such as a concussion or worse. Among the many side effects of brain injuries, concussion have also been linked to suicide. Additionally, concussion can lead to depression and anger. Ito yung sa equipment na once na yung equipment, gamit mo yung helmet, knee pad, yan. Kapag hindi sila good working condition, maaaring maapektuhan yung bata na magsusuot nito. Maaaring madamage yung kanilang ulo. Iyon. Next slide. Make make sure sports protective equipment is on good condition. If your child wear protective equipment such as football pads, knee pads, or shin guard, it's also extremely important to make sure they are protecting your child the way you should be. If the pads are missing pieces, don't fit correctly, or seem to have a lot of damage or wear, it can lead to serious injury. If this if this is the case, be sure to replace the protective equipment or ask it to be replaced if it is the properly of a school or club. Next slide. How can equipment cause an injury in sports? Even if a piece of equipment or clothing is brand new, if it doesn't fit, it can cause damage. Something too small can expose your children to injury. Something too large can shift or move easily. Exposing sensitive areas, if the sports equipment is too large, it can also restrict or inhibit movement. Ito yung sa mga gamit nila, supporter sa katawan. Yan, kapag hindi yan fit, hindi yan maganda. Kumbaga hindi sila makakakilos ng maayos, mapapalang yung kanilang skill na mailabas. Yan. Next slide. Solution between sponsoring organization and sports medicine officer. Healthcare professionals now have to be more careful while prescribing drugs or sports person because some of the drugs are banned by the IOC, National Collegiate Athletes Association, and other athlete organizations. If athletes approach healthcare professions as ordinary patients, then there is a high possibility of missing out on the potential dropping issue with a prescription of drugs. Athletes who test positive for the prohibited drugs can be disqualified from the sporting event, suspended for a defined period, or may get a lifetime ban. Yan yung pagsabuatan nila ng mga nag-i-sponsor na maaari naman pala maban yung mga athletes sa mga ni-sponsor nilang mga gamot na akala naman ng iba is vitamins pero once na inin mo yon at titines ka, maaaring mag-positive, maaari kang mag-positive sa drug test, then kokosita na hindi ka na makakalaro, ka na, hindi ka na pwede maglaro. Ayun. Next slide. Athletic insurance, athletic event insurance, and team insurance. Whether your team is playing basketball, baseball, basketball, football, or soccer, all sports are energetic, dynamic, happening where accident can hold. Our sports insurance provide the team and athletic insurance unit for all your athletic events. Sports insurance coverage can be placed for all sporting events such as amateur sports league, team league, youth camps, and tournament, tra- triathlons, clinic, and ethic to include protection for claim made by participation. Ayan, sa sports, sa larangan ng sports, lagi tayong merong insurance kasi alam natin dyan na physical na maaaring magkaroon ng pagkakamali sa ating ginagawa kaya na maaaring mag-cause ng ating physical harm kaya may mga insurance tayo para mapunan yung at mapunan at mapunan lalo na yung sa mga panggagamot, pagpapagamot. Next slide. This is our reference to the topic discussed. And thank you for listening. Okay na po.